When you think about testing your genetic information, genetic testing on embryos before they're transferred, there are a lot of different tests. It's called PGD, Preimplantation Genetic Testing, and it can be very misleading. It is extremely important, but it's also important that you know what you're getting. A lot of times I find people are taken advantage of and pay a lot of money for a test that isn't as high standard, isn't as good as what they're expecting. You can test for 5, you can test for 10, test for 15 chromosomes. What you really want is for all of them, all 24 chromosomes to be tested. You also want them to be tested by the next generation sequencing screening method. This is really important because it's the highest standard. So if you're going to have your embryos tested for genetic abnormalities, highly suggest doing it right. That's why we include genetic testing in all our all-inclusive programs for surrogacy. We find, and this is held up with all the studies, that the success rate is so much higher and that there are never any miscarriages. So please, when you're looking and making decisions between surrogacy providers, I would definitely look for PGD, and again, make sure that's for all 24 chromosomes, and that it's done by NGS, next generation screening methodology.